If you want to learn everything you need to know as a nurse about factor Xa inhibitors, then this is the video for you. Factor Xa inhibitors such as apixaban and rivaroxaban are anticoagulants that are easy to remember because they end in Xa-ban. Factor Xa inhibitors are used for the treatment and prevention of clots, also called thrombi, such as with deep vein thrombosis, pulmonary embolisms, ischemic strokes, atrial arrhythmias, and as post-op prophylaxis after knee or hip surgery. Factor Xa inhibitors work by interrupting the coagulation cascade. They block factor Xa, an enzyme required for converting prothrombin, also known as factor II, to thrombin, also known as factor IIa. Without thrombin, fibrinogen, also known as factor I, is not converted into fibrin, also known as factor Ia. Therefore, factor Xa inhibitors indirectly block fibrin, a sticky protein that creates a mesh that holds platelets together to create and stabilize a thrombus. The most common complication of factor Xa inhibitors is bleeding. Because factor Xa inhibitors increase the risk of bleeding, it is important that individuals on this therapy avoid injury, such as intramuscular injections in high-impact sports. If an injury does occur, especially with possible injury to the head, such as with a fall, it is important to monitor for neurological changes, due to the increased risk of an intracranial hemorrhage. Additionally, substituting for a soft bristle toothbrush and an electric razor instead of a blade for shaving is suggested. It is also important to monitor for bleeding from gums, nose, and wounds, or for blood in stool or urine. To monitor for internal bleeding, periodic CBCs may be completed, and if bleeding does become a concern, andexanet alpha, the antidote, can be administered. Additionally, factor Xa inhibitors should not be used during any active bleeding, such as a recent trauma or gastrointestinal bleed. Aspirin and NSAIDs should also be avoided, as they further increase the risk of bleeding. And finally, factor Xa inhibitors should not be stopped abruptly, as doing so increases the risk of thrombus formation. This wraps up everything you need to know as a nurse about factor Xa inhibitors. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!